welcome to Senior Happenings. My name is Trisha Ayers, and I will be your host for the show today. As ever, I'm very excited. We're going to get into some great subjects. We're going to start with diabetes. Everybody's excited about diabetes, I'm sure. And I'd like to welcome back to the show Dr. Bichala. She was so kind enough to come back and give us more great information. I'd like to thank you so much for being on the show again today.
I'm very glad to be back. Thank you for having me back,
And
Trisha.
we're talking about diabetes.
Yes.
We have to talk about it, especially when we get into our senior years, I think.
Yes.
So could you tell us, what is diabetes?
So it's basically a condition where the body's not metabolizing sugar and associated nutrients properly and storing them appropriately, and that ends up being a high levels of sugar in the circulation itself, which is not healthy for the body, because anytime, everybody knows when there's high sugar levels, it's a magnet for all sorts of pathologies, whether it's infections, inflammation, and then complications from all of that.
And what types are there of diabetes?
So one important thing with medicine is things are always evolving. Let me not say changing, but it's always evolving. But traditionally, diabetes has been divided into kind of two major groups, and then there's a third subset which is completely different. But type 1 is considered the type of diabetes where there is an inherent deficiency of the main one of the pancreatic digestive enzymes, insulin, which is one of the big moderators of managing the blood sugar levels.
Okay.
And then there is the type 2 diabetes, which is not a deficiency, where you do have your inherent insulin levels, but it's not working the way it should be. So another synonym for type 2 diabetes is something that we use very commonly as medical professionals is insulin resistance.
Okay.
So it's there in your body, but it's not working the way it should be. So
Okay.
those are the main two divisions or classification we would do to manage diabetes.
Yes, that's
Yeah.
what we hear about more. Now, do genetics play a part?
Yes, genetics play a big part, more so in the type 1.
Okay.
Maybe less so in the type 2, but if you have a family history of whether it's type 1 or type 2 diabetes, you have an increased risk. So yes, genetics play a big role.
Is there one that's considered more serious to manage, type 1 or type 2, or can both be?
Type 1 can be more, complications can be more rapid onset. I don't know if you've heard of diabetic ketoacidosis, but that is one of the major complications of type 1 diabetes. So when they reach blood sugars above 300 and stuff, your kidneys, they're not able to deal with that level of blood sugars, and you go into what we call an acidotic state, which is not compatible with life.
Okay.
So that's a very dangerous situation with type 1 diabetes. Type 2 can be more insidious, like we say. It's like you won't feel a lot of the problems, still hell breaks loose. But so you can actually be type 2 diabetic without realizing it for a long time, and then happens. It's much less frequent now because we're focusing on the preventative care.
Yes.
But in the olden days, that's what used to happen, that people always used to think that they're fine, but they're not.
So what are some of the symptoms that we can look for at home before we go to our provider?
Diabetes can be very tricky that way. It can be asymptomatic. The most common presentation is asymptomatic. But type 1s might present with the diabetic ketoacidosis, like they're having nausea, vomiting, abdominal pain, they're just not feeling well, they can't eat anything, they can't drink anything. That can be the type 1's kind of presentation.
Yes.
The type 2s, they're more asymptomatic kind. And they might, but some of the type 2s may see increased thirst, increased urination, and then increased infections, more commonly skin infections. And sometimes people also present with tingling and numbness in their feet without anything else. So I would say those are the
Right.
common ones.
So
Yeah.
if you have any of those symptoms, you should
Yes.
get them checked
You
out.
should what
What can
talk to your
we
provider.
do to manage if we're pre-diabetic or on our way to being diabetic? I'm sure there's things that we can do ourselves that probably.
So pre-diabetes is a more modern concept when it comes to medicine.
Yes.
And that was developed with the intention that we need to catch diabetes at an earlier stage. So if you
Right.
think about it, technically it's not a condition.
Okay.
But we want it categorized, we have categorized it there as a medical society so that we can catch people earlier and prevent them from becoming diabetic.
So are we seeing pre-diabetes in our kids because of soda machines and sedentary?
We most definitely are possible.
Right.
We are most definitely are.
Okay.
Especially, yes, now lifestyle changes with our recent lifestyle habits and stuff. Yes, they're definitely predisposing us to more developing prediabetes and diabetes much earlier than
Right.
before. That's what I meant when I said things always evolve, because
Yes.
we are changing as a society. We are changing things, and those are not separate to our health.
Right.
So it affects our health, and that's why we are seeing type 2 diabetes more commonly in even teens, adolescents, which was unheard of when I was studying, because
Certainly.
when I was doing medical college, type 1 is like children's disease, and
Yes.
type 2 is like adults' disease.
Right.
But that line has blurred completely since I've started practice, and it's evolving.
So can we reverse or we can manage?
It's always controllable.
Okay.
Yes, it's totally controllable. It's about being aware of it. It's being mindful.
Yes.
And changing things which you know are hurting you, and trying to avoid things which will hurt you. And it's a combination of lifestyle management along with medications, exercise, everything.
All
So
the things
it's
that we
a
don't want
holistic
to
thing.
hear. That we don't want to hear as a patient. You need to probably not eat that, and you probably need to get a little
You
bit more
probably
exercise.
can eat that, but
Right.
you can't probably eat that all the time.
Right.
So, yes.
And what medications are available for?
Diabetes is a totally different world now, like diabetes medications.
Yes.
20 years ago, we had very limited. Insulin was the main mode of management, along
Yes.
with metformin and medications like glipizide and gliclazide. That may be a wrong name, but there were quite a few limited medications.
Right.
But in the last 20 years, the landscape has completely changed. And we have now medications which work through your kidneys and actually flush the blood sugar out. We have medications which are injectables, which work on different levels of your body, at the nervous system level, at the GI level, at the pancreatic level. Those injections actually reduce your appetite and make your insulin work better.
Oh,
So they're key in insulin resistance.
right.
So, and that, I'm sure you've heard of a lot of weight loss medications,
Yes.
which are being used for the dual purpose of managing weight and diabetes.
Right.
They're called GLP-1 analogs, and
Okay.
one of the commonest the first one of that was Byetta, but
Okay.
we don't use that. I mean, it's a lot of newer medications
Sure.
have come into the market now, and there is a lot of shortage of them also because of
People
various
are using them for
issues
weight loss,
and
probably. Yes.
yes,
Yes.
because of people wanting to use them more so for weight loss,
Right.
and cost has been a concern. So lots of
Sure.
issues about it, but we can use those tools and tailor those tools to each patient because each patient is different.
Right.
Each person is different.
But how
So
great that you have so many tools.
tools now, yes. So the tools are so different, and it's much easier also. Of course, they come with side effects, but you have more tools. So you have to combine them with lifestyle factors and you can successfully manage diabetes.
That's great.
A lot of people look at it as a label and feel bad about it.
Yes.
I would say the first things to not do is feel about it that way.
Sure.
And work around that.
It's manageable.
That that thought process.
Right.
Yes,
And you
it
can
is
go out
totally
and
manageable.
live your life with it.
Exactly.
So if our senior comes in to see you with some of the symptoms, what is it, a blood test that you do?
Yes.
And that gives you
Yes, it's called the hemoglobin A1C, or glycosylated hemoglobin. We look at that for pretty much diagnosis of the diabetes, and also whether it's prediabetes, diabetes, and we continue to use it in the future to see how well they're controlled with their diabetes as well.
That's great. So many options for folks. So you should definitely go get tested. If you're feeling any of those symptoms, you should always go for your regular checkups anyway.
It's a part of prevention is better than cure.
Absolutely.
So please do take advantage of your physicals and the annual wellness visits to get those concerns addressed for sure.
Absolutely. Once again, thank you so much.
Thank you.
For educating me and the rest of our audience out here.
Thank you so much.
You'll have to come back again. We'll have to pick another. We'll just work through the body. We'll just work through all of it. So, Dr. Bichala, thank you so much. Dr. Bichala is with Mercy. She is at the Bentonville Clinic, just shy of Bella Vista, just outside of Bella Vista. So if any of you are looking for a primary care physician, please go and see Dr. Bichala. I'm sure she would love to help you in your health journey. We're going to take a short pause and we will be back with Laurel Shepherd, and she's going to be talking to us about hydration. So very important right now. We're going to be in the hundreds next week. We need to know about hydration. Thank you so much. Welcome back, and here we are. And as I said before the break, we're going to get in the 100-degree temperatures next week, so this is so very important. We're going to be talking about hydration, and I'd like to welcome to the show Laurel Shepherd, and she is with Kendrick Fincher Hydration for Life.
Thank you for having me. Glad to be here.
You're so welcome. Can you tell us a little bit about the nonprofit and why it was formed and the story behind it, just in case anybody is not aware of what it's for?
Yes. So our organization is named after Kendrick Fincher, and he was a boy who lived here in Northwest Arkansas, and he really loved playing sports, especially in football. And one day he went to football practice in August, very hot, as we know it gets here, and he suffered from a heat stroke. And he was in the hospital for many weeks, and unfortunately he passed away. And it was such a tragic thing because heat strokes are preventable, and they're also treatable when you know what to do. And so our organization was formed to help prevent those kind of tragedies from happening and to help educate the public on hydration and heat illness prevention. So that's what we do.
How long have you been with the organization?
I've been with the organization for about 3.5 years now.
Okay.
And our organization has been serving the community for over 26 years now, I think.
Yes, that's a long time.
Yes.
Driven by the mom.
Yes. His mother,
Yes.
Rhonda, started the organization, and she was the executive director for many, many, many years. She just retired earlier this year, so we have a new executive director, Kayla, and we're just continuing the mission and continuing to serve the community.
She's a very gracious lady, always, any of the nonprofits in the area, always willing to sit down. And she talked to us when I was at Village House
Oh, yes.
about the operations and how they fundraise, and just always giving of information, which was always so appreciated.
Yes,
So-
we try to share our message any way we
Yes.
can within the community and
So-
just help people stay safe, stay hydrated.
Sharing your message, where do you get to share your message?
All over the place. So I go to schools and I present to kids. I teach coaches and teams. We go to the senior centers. We go to the like the Senior Expo. We go to festivals and set up booths, and we just try to share our message as much as we can within the community.
Anywhere that you can educate
Yes.
people.
Yes.
And I also know there's always lots of merch. There's always lots of water bottles. I see the logo everywhere, which is so great as a reminder.
Yes, whenever I go and give a presentation, I take water bottles for the kids so they have that bottle with them. They can carry it with them throughout their school day, stay hydrated. It's got our logo on it, has information on it just to help remind them the things they've learned. So.
And
Yes.
do you do the presentations when
I
you go
do.
to school?
Yep.
So what are some of the things that you touch on with the kids?
So with the kids, we always talk about, it's called our Be Hydrated program, and we have 3 Bs that they learn. So they learn to be aware, and that's learning all the facts about hydration, about why it's important for your body and how much you should be drinking and all of those sorts of things. We teach them to be a detective, and that's to kind of look for those signs and symptoms of dehydration. And we finally teach them to be healthy and make healthy drink choices. And we figure when they do those 3 things that they're going to be able to stay hydrated and stay safe. So.
And I think that transitions to our seniors, but our seniors sometimes, I know myself, drinking enough water, it's hard sometimes. It's very hard sometimes. And sometimes I think it's hard to regulate your body as to whether you're being hydrated.
Exactly, and seniors especially are at an increased risk for dehydration. In fact, dehydration is one of the leading causes of hospitalization with people who are over the age of 65, and so it's really important for seniors. And some of the reasons they're at a risk is, certain medications or medical conditions, even just our thirst sensation diminishes as we age, and so you may not even realize that you're thirsty. You have a lower volume of water in your body as you age as well, and so you're already just kind of predisposed to dehydration, and so it's really important to stay on top of that and make sure that you're drinking.
Could you give us the website, because that was a wealth of information for me.
Yes.
Would you mind?
It's just kendrickfincher.org.
kendrickfincher.org.
Yep.
Yes, I would highly recommend folks going to the website. I'm going to put my glasses on now, show you my age here. But there was it said 80% of the brain is made up of water. 75% of muscles are made up of water. 92% of the blood is made up of water. Water is really important, hydrating.
Oh, absolutely. It's an essential nutrient that every single cell in our body needs water to operate correctly, and it has so many benefits for our body. It helps our mind stay clear and focused. It helps our bodies regulate their body temperature. It helps take the nutrients throughout our body. It's just needed for everything. It's so important that we have the water.
What are some good alternatives if water just doesn't taste good to you?
Yes. Absolutely, yeah. We talk about being healthy, so there are other drink choices you can make if water's not your favorite. An easy one is to just try to infuse your water, especially in the summer. That's kind of fun to have like different fruits or vegetables that you can infuse with your water, give it a little flavor. You can also go with things like 100% fruit juices. Milk, good for your teeth, good for your bones, all of that. We say just try to avoid the sugar-sweetened beverages and maybe save those for your occasional treat and not necessarily what you want to drink all day long.
Right. I think that's our problem sometimes.
Yes.
Starbucks.
Yep. All that sugar is a little here, a little there, a little there. It
Not
adds
to blame
up.
Starbucks, but that convenience of driving through, and just water just doesn't taste good sometimes, especially when you have done the coffee and the tea and the sugar drinks. It's hard to change.
kind of dial it back to just water.
And how much water should we be drinking?
So the formula that we say is your weight divided by 2 are the liquid ounces for you. So if someone's 140 pounds, they should be drinking 70 ounces of water a day. And that's kind of your baseline, but on days where it's really hot and you're sweating a lot or you're doing a lot of physical activity, you're going to want to increase that water to make up for the water you've lost through sweating.
Right. And as you say, medication can be...
Yeah, absolutely. And I would recommend if you're on certain medications where you do have to limit your fluids and such, definitely talk to your doctor and find out what your best options are.
What are some of the events that you have coming up?
We are going to be at a few different community events. We like to go and set up what we call cool huts, where we have misters set up so people can come and cool off. We give away free water so they can hydrate. So we're going to be at the Bentonville Honor Fest in a couple of weeks, as well as the Firefly Fling down at the Botanical Gardens in Fayetteville. And we have our own event. We're hosting a golf tournament on July 31st at the Lost Springs Golf Course in Rogers.
Right.
And it's a 4-person scramble, and we'd love to have anyone come out and participate in that. We're going to have prizes, lunch, all of that provided.
And we have lots of folks who like to play golf in Bella Vista, so
yes.
hopefully there's some teams out there that can participate for a very good cause. So they can go on the website to find
Yep.
out information about
You can
that.
go on the website or our Facebook page, and we have all that information listed. You can get a team signed up and join us.
Do you have events going the whole year, basically?
We do. We also have a gala that will be coming up in August. We always do a 5K run and a youth run as well. That's usually in the spring. We just had that in May. And we have a few other events that our new executive director has some ideas up her
Yes.
sleeve. So we have a few more things that may be coming
That's
in the fall.
exciting.
So keep your eyes open for those.
So I'm going to put you on the spot
Oh,
here,
okay.
seeing as you've been in your position for three and a half years. Any heartwarming stories that you've heard?
Heartwarming stories.
I know I'm putting you on the spot
I
now.
don't know. It is interesting sometimes when I'll go to events that there will be people who will come up and they'll say, I still have my water bottle from like 20 years ago when they were in elementary school, and
Right.
that they've gotten those. And so it's fun to see that that message has stuck with them and that they still remember
Right.
things that they've learned. So that does happen at events. People always come up and tell us that. Or we had a young man win his age division in the race that we had in the fall, or in the spring, excuse me, and we found a picture of him competing when he was like 5 or 6 years old, that he had competed as a young boy, and now here he was like 20 years old and
That's great.
still running the race
That
with
is so
us.
good. The message has been understood.
Yes.
And hopefully you're changing lives by
Yeah.
educating. So that's really important stuff. I'm sure your schedule ramps up when school gets back in.
Yes, yep, we try and stay busy. Our goal is to, right now we're focused on second graders, is to educate every second grader in Northwest Arkansas, to give them a water bottle and take them through our curriculum. So it's a big task, but that's what we're shooting for this
How
next
many
school year.
water bottles is that?
Several thousand.
Wow. Wow, yes, that is quite a feat.
Yeah.
Well, I look forward to seeing all of those water bottles out there.
As do I. Yep.
And for our seniors, you are open to going into any community, speaking to any group.
Absolutely.
If we have a senior group out there that are like, yes, we need to get to
Yep,
that.
I would love to come and be a guest speaker anytime, so they're welcome to contact me, and they can do that through our website. There's a contact
Okay.
form on there that they can reach
right.
out, and we'd love to come and speak.
Good, and I hope you'll be at the Senior Expo again in
Yes.
September.
Yep, we'll be there.
Good, 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 good. Well, Laurel, thank you so much for coming and
Thank you
speaking.
for having me.
Very important about hydration. It's one of those foundation things that we need to get to our youngsters, but also our seniors need to take heed of that. I think
Absolutely. Thanks for having me.
I need to drink more water too. Okay. Well, thank you so much for joining us in Senior Happenings. We hope you use this information about diabetes and hydration, and we will see you next time with some interesting subjects for our seniors. Thank you. Bye-bye.